So the word respirator was used at this hospital in the ER room. We'll probably put you on a respirator. Now, I have worked with hospitals in the UK, and because of my job visiting patients who've been really ill, and I've seen lots of people that have been on respirators, and I'm not trying to scare anybody because this just scares me, and not many of them survived. So I thought, bugger that, I am not going on a respirator, even though I need oxygen in my lungs. I'm not going to go on a respirator. Now, my oxygen level was 93, and if it had dropped below 90, that's when they were going to stick me on a respirator. So I then thought to myself, even though I wasn't well, you know, this is the night after Sally really thought I was going to pass away. I thought to myself, I have got to do something with my lungs. And I started doing lung exercises. Didn't even tell Sally, I just started doing them.
You needed to do deep breathing. I didn't know what else you were going to do, but I said you needed to try and get some oxygen into your lungs.
So many, many years ago, I used to practice a therapy called EFT, Emotional Freedom Technique. Emotional Freedom, Google it, Emotional Freedom Technique, and put in the search Gary Craig, C-R-A-I-G, Gary Craig. He's got a wonderful 5-minute video that explains how it works. And one of the exercises I used to do with EFT was expand my lungs. So this is what I started to do. And within 48 hours, my oxygen level increased from 93 to 99. Okay? No respirator required. From that moment on, my general health started to improve at quite a rapid rate. Now, every day they keep an eye on us, 4 lots of tests a day. There's been more blood tests, x-ray and so on, but every day we get blood pressure, temperature, my blood sugar level, they listen to the oxygen level, and they listen all over the lungs, you know, with a stethoscope. And my stethoscope for days, I'm not exaggerating, it's probably the best part of a week, all clear. They can't hear anything. In the early days, they were hearing crackling. Now there's nothing, it's all clear. All of our test results are really good. Really, I don't want to use the word positive, but really, really good results. I don't want to use positive because this is the nasal test that goes up the nose, down the throat, that checks for the virus, and you either have a positive or a negative result. And I'm getting positive results. I've had one negative, but at the moment I'm still on positive, and I need that to become a series of negatives before we're released out of the hospital. So that's the first thing to look out for: a cough, a fever, a throat. Now, we didn't have the throat, but we got 2 of the 3, and we definitely had the coronavirus because, God, I've still got part of it in me, just the remnants of it.
I think some people get a headache as well. We didn't get that.
Some have had a headache. Yeah, we were asked that question a lot. Have you got a headache? No, we've had no headache. So that's where we are at right now. We're being tested every single day regularly. We're being given the food that meets our medical needs for our body.
Not necessarily what we like.
It's not what we're used to in the Western culture, but I've got quite used now to much of the Japanese food. We don't have a knife and fork, we have chopsticks. And that's one of the bonuses of being here. I've got really, really good with chopsticks. So I'm looking forward back home going into a Chinese restaurant and eating with the chopsticks. Quite looking forward to that. So that was a bonus. So with hindsight, yeah, we were in denial without any doubt, or I was. Total denial. Do you know, I am breaking the bed that we are in.
David,
it's terrible. Bits keep falling. Just take all the stuff there, Sal. Just show them what's come off the bed. The bed isn't long enough for an English body.
You're moving your
I know.
around all the time.
This bed is not long enough for an average Englishman. Can you see all this?
The bottom of the bed.
This is the bottom of the bed where my feet rest again, and you can't get it back in. It's broken, and something else just fell off then, you see. But anyway, there we are. So with hindsight, I was in denial. Cough, fever, and throat, although I didn't have a throat. If you get those symptoms, don't hesitate. Contact your medical provider and ask for their advice. Simple as that.
Don't turn up at your doctor's surgery because they will not welcome you.
Yeah, so in the UK, you dial, I think it's 911.
No, 111.
111. They've got a lot of drive-ins now where you drive in, you don't get out of the car, and they'll give you the test literally through the window. And if you test positive, you're told to go back at home. Well, you wouldn't get the result that quickly. You'd be told to go back home, wait for the call. If you're positive, you self-quarantine for 14 days. Now, we have been in hospital almost 3 weeks, 1 day short of 3 weeks. So the question that I would be asking the world is 14 days quarantine sufficient? I'm still showing positive after 3 weeks in hospital.
And
we'd had it for probably 6 days before we came to hospital. Okay, so is 14 days sufficient? I think that really is about it, isn't it?
Well,
the odds are we're not contagious, by the way. I've just got remnants of the virus. So you'd probably be very safe to mix with people, but I'd never do that. I want to be totally clear 100% before I mix with anybody. Yeah.
I was reading this morning one of the Australians, having done 5 weeks in quarantine, she's still being told that when she goes home, she'll have to do a further 2 weeks.
Yeah. And I think that's sensible.
Mind you, she does work in the care profession,
yeah.
So she would be mixing with vulnerable people, but that means that in the end, she would have done 7 weeks quarantine from when she first went into hospital.
Yeah. So if we were back in the UK and this was happening to us, we would do things a little bit differently. At home, we have an inhaler for when we get a cold, and it's just a plastic jug, and the lid is it goes over your nose and mouth, and into that we pour boiling water, so we've got steam, and we put a couple of drops of, what's it called?
Obicil, I think it's called.
Well, I can't remember the name, but it doesn't matter. But we put a couple of drops, it's like camphor. You know, in the olden days, my grandmother used to have a big bowl of steaming water. She'd put camphor into the water, it floated, and a towel over your head, and you would just take it into your lungs. That is the principle that we have with this. So we would have been using this back in the UK to kill any viruses, anything that's going on in the lungs. I'd have still been doing lung exercises to expand the lung, to get as much oxygen in as we could, and we would definitely be dosing up on vitamins.
So we've got vitamins. We have got vitamins here.
Yeah.
That somebody got for us. I think it was Princess Cruises got us vitamin C.
They did.
3 or 4 packets.
But it's vitamin D that I think we really
D,
need.
we need the sunshine.
Yeah.
That's basically what
that is what we need. Because although it's a sunny day today, yesterday it was pouring with rain the entire day. It's sunny, but it doesn't come into the room.
Not till
well, it does at about 4
about
o'clock,
4
and it just hits the far wall.
just before the sun goes down.
But it doesn't warm the room or radiate the light into the room.
But we can see it.
We can see it.
Which is a lot better.
And it's
than a brick
lovely.
wall.
You know, we've got a lovely tree out here, and yeah, blue sky today. And Friday, the orange blossom comes out in Japan. Sad that all the events have been cancelled. So visitors will still be able to see the orange blossom, but
not orange blossom,
cherry blossom.
Cherry blossom.
Oh God, my mind. Cherry blossom. They'll be able to see the cherry blossom. Where did we have orange blossom? Florida. Yeah, they'll be able to see the cherry blossom, but the events in all the parks, every event has been cancelled. So there you go. That is our story on what we experienced. I'm not going to say that it's going to be the same experience for everybody all over the world. This is our experience and how the hospital have dealt with it. I think the biggest issue is if you get pneumonia, it needs to be determined whether it is viral pneumonia or bacterial pneumonia as soon as possible. And it's only the hospital that's going to determine that. And if it's bacterial, you'll be on antibiotics. If it's viral, they wait and let it work its way out. Now, my latest x-rays have shown I am totally clear of the pneumonia. The virus isn't showing on the x-rays. It's remnants, they say, that are in the nostrils or in the back of the throat. So what I've done today, because I'm having another test this morning, so what I do, can you pass me the chopstick? What I do, you might think this is going over the top, but if I've got remnants of it in my nostril, chopsticks come in very good. So I blow my nose, and I never have anything when I blow my nose, nothing comes down ever, always have a dry nose. And I get a clean tissue, this one I've just used to do this exercise, and now I've got clean end to the chopstick. I dip that in warm water and that goes up each nostril, change it for another piece of clean tissue to do the other nostril, and that's what I did for the test 48 hours ago, and the bloody thing came back positive, so I'm not convinced it works. But I'm doing everything I can. If we had salt in the room, I would be gargling with salt. But all I'm doing is gargling with water, which I can't see is going to help a great deal.
No, the other thing is, I mean, you could sniff the water up so it goes round and comes out through your mouth.
No, thank you.
But I've tried doing that at some stage, not this time, and it's horrible. I don't like it. It's like drowning in a cup. So
look, the whole purpose of this video was to show you what our symptoms were, or to tell you what our symptoms were, how we've coped with it, and the experience that we've had whilst enjoying our friend the coronavirus. People have been asking me, what strain is it? There are 2 strains apparently. I don't know, and quite honestly, I don't really care, because I am not going to go up to people in the street walking towards me and saying, which strain have you got, because I might be infected. You know, so I am, what we now have to do is be more cautious than we've ever been in the whole of our lives. The elderly, of which we are in that bracket, are the most at risk. You know, and
very young.
And the very young
people
are also at risk.
People with asthma and
so,
other health
if you've got underlying health conditions, you know, we're in a higher risk bracket. So our, not fear, but our major concern is when we finally leave this hospital and we go out there in the big wide world, and the first big place that we're going to be going, most likely, is the airport. And we're going to be seeing people in masks. There may be some sneezing, some coughing, whatever. There'll certainly be no handshaking from us anywhere. You know, that is totally out.
Done now.
There's going to be a lot of hot hand washing, whether we need to wash them or not. It's going to happen. We've now got that as a regular habit. But the danger for us is, if we come into contact with somebody that was to sneeze straight into our face, it's unlikely, but we're not going to wear the masks that anything could come in at the sides. It's a tight-fitting mask that we've got for when we leave here. But if somebody did manage to cough or sneeze straight into our face, that's the big danger. We won't be reinfected with this same virus that we've got. But we will be open to receive anything else.
And we'll be open
to colds, flu.
More to more colds and flu. Yeah. But we did both have at home, not just before Christmas, we both had a flu.
Yeah, good point.
A flu shot, and we both have had, in the last 2 years, we've had a pneumonia shot. Yeah. And I firmly believe that that has made a difference to how we've coped with it.
Yeah.
Yes, David was very poorly, but it did only last a couple of days.
Yeah.
Um,
Yeah, and as everybody will say to you that's had the coronavirus, you generally feel really good.
yeah,
You know, you don't realise that you've got it. And the only time now, looking back, reflecting on all of this, it's when we left the ship to come to the first hospital. That was when I was at my worst.
yeah.
And I didn't realise it until I
Until you
experienced
left
that
the cabin and
breathlessness.
you actually had to.
And God, that was frightening.
Well,
That
'cause
was frightening.
We had 3 people escorting us down to the ambulance, and he had to keep stopping and saying, "I can't walk this fast. I can't keep up this pace."
I have to
and he
keep
was
saying, slow
really
down, I can't keep up.
gasping for breath.
It was, I've never experienced anything like that in my life. That's when I realised something's wrong. And yeah, so there you go. I hope you found it helpful. If you feel you've contracted this disease, contact your medical provider. By phone, contact them, explain your symptoms, how you're feeling, and then take all the precautions you can. Regular hand washing. Don't shake people's hands. The antibacterial gel is good, but it's not as good as the hand washing.
Soap and water is the best thing you can
it's
do.
the best thing of the lot.
I know you can't
Best
take
thing of the lot.
soap and water out with you when you go out, so hand sanitizer
Yeah.
is an extra. But
Yeah.
soap and water is much, much better than hand sanitizer.
And exercise your lungs. If pneumonia should happen to get in and it's viral, exercise those lungs, expand them, get as much oxygen in as you can. That was my mega turning point, absolutely. And it's Gary Craig, Emotional Freedom Technique. Emotional Freedom Technique, Gary Craig, and you'll learn all about it, and it's totally free. And it's something you can teach yourself. It's brilliant.
I think the other thing is, if you happen to live in a country where it's warmer, get yourself out in the sunshine.
Yeah,
Sit
the
in your
virus
back-
can't
sit in your
exist in
backyard.
heat.
Sit in your backyard and sit in the sun. Find
Yeah.
yourself a spot out of the wind and just enjoy the sunshine, because that will help you. It does help get rid of the virus, and it makes sort of for your own well-being as well.
So don't be scared. You know, a lot of people of our age, and maybe younger, maybe slightly older, what we are hearing is that you're scared, you're terrified. Don't let this beat you, all right? We can beat this, providing we deal with it in a timely manner and we really take all those precautions afterwards. Don't be scared. Life must go on. Life is for living, it's not for dying. You know, we live every day, we die once. We don't want to die that once too soon, do we? Prematurely. So life is for living. Don't let it take control of you. You take control of this virus. You take control of your body. And Gary Craig, Emotional Freedom Technique, will help you to do exactly that. Okay, we've said enough. That's it. Get on now with your lives. Really enjoy it. Have a great day wherever you are in this world. Have a wonderful day. Bye for now.